I think that you will agree with me that what we're doing for our patients with diabetes is not working. As you know, many of our patients who develop type 2 diabetes, first, they have gained weight, they have developed overweight, and they have developed obesity. So the concept of diabetes comes from the role that weight gain and obesity cause in the development of type 2 diabetes.
In terms of what we're going to be talking about today.
Today I'm going to go through a few different dietary patterns.
All the research that we're doing, I think, will help us answer these questions.
So what happens to those folks that have class 1 obesity?
We think that we have the tools to help our patients who suffer diabetes to lose weight, to improve their general health and get their diabetes under better control.